Yes, I'm pretty early on in the seasons, but I was pretty excited when I found this episode or part of the episode here that was on Munchausen Syndrome. So I'm just going to play that for you guys to get a good idea of what it is to start. All right, so that was just a little idea there. Wait, how do I click here? There we go. So I'll just start and dive right in with diagnosis and a brief description and get into aspects of the video later when we get to symptoms. So Munchausen syndrome is when people intentionally fabricate a physical or mental issue in order to assume the role of a patient with no obvious gain. Diagnosis for Munchausen is really difficult. Care providers must first rule out any legitimate physical or mental issues that the patient might be having before they can even consider that they're going to be fake. Patients will pretend to be in pain, exaggerate symptoms, have fake symptoms, poison or infect themselves, or tamper with their test results. The DSM-4 diagnostic criteria for Munchausen syndrome included intentional production or feigning of physical or physiological signs or symptoms. Motivation for behavior is to assume the sick role, and absence of external incentives for the behavior. So they don't really have a reason to do this besides being the patient. I also thought it was important to note that the term Munchausen syndrome most appropriately refers to the subset of patients who have a chronic factitious disorder, which is a type of somatic disorder. And in practice, people will still use the term Munchausen syndrome interchangeably with factitious disorders. So you might be seeing different ones. You might be seeing both of those terms, but it's important to remember that Munchausen syndrome is when people mainly have the physical aspects of these symptoms. So the etiology behind this, there's many different theories with little agreement or evidence on what actually causes Munchausen syndrome. A lot of these are based around the need that this person may have for care and attention, and then their behavior reflecting this to satisfy this emotional need. Some theories suggest that the individual could have had experiences in the past, like abuse or neglect as a child, reliving an earlier serious illness, which is what they would be doing in the present, not having had in the past. Identifying with a close friend or relative who has had a serious illness. Inability to trust authority figures such as doctors. Brain dysfunction with really no genetic links or abnormalities. And the presence of a personality disorder, depression, or substance abuse. The incidence for Munchausen syndrome is really unreliable because of the dishonesty that comes with this illness and the fact that people will switch different hospitals and care providers once it's discovered that they have Munchausen or that they're lying about what's actually happening to them. So It is a rare disorder, but it's even harder to get the information on it because people will leave so soon. The symptomology behind this, you've seen a lot of these examples in the video, but all symptoms are patient-induced, so they do this to themselves, and that happens in a lot of different ways, which I'll touch on after I go over the symptoms, which is a long history of unexplained illness, a willingness to accept discomfort, and crazy medical procedures like surgery, a textbook knowledge of the supposed illness and practices in general, which we saw in the video, vagueness about actual disorders or her condition, exaggeration or lying about other aspects of her life or his life, hostility or dramatic behavior, stomach issues, respiratory issues, allergic reactions, unexplained bleeding or discharge, anemia or failure to thrive, which would also be like malnutrition, like they're just not eating, they're not taking care of themselves on purpose, abnormal test results or symptoms of extremely rare or dramatic disorders. So as I touched on earlier, people go through crazy methods to induce these symptoms. Some of these include smothering or suffocating, taking laxatives or other drugs to induce their symptoms, swallowing or ingesting hazardous substances, scratching or deliberately injuring their skin, disconnecting drips or IV lines, switching patient charts, and interfering with test samples. All of these are just ways that people feel that they can get the attention that they need, and that's what they have to do in order to get the symptoms to be a patient. The prognosis for this is not very high. Some individuals have a few episodes and can improve, but the disorder is often long-term and difficult to treat. This happens also because people will leave the hospital once it's discovered that they're lying, and it's hard to even get treatment with them because they don't want to stay there and they don't want to be treated. Related populations and lifespan considerations for Munchausen syndrome. So the most common people with factitious diseases are women aged 20 to 40, often working in the medical field. They tend to be unmarried and estranged from their families. I thought it was interesting that a lot of the people actually work in the medical field that have this disorder, so they have the background knowledge that they need to know in order to fake these disorders to other people or other doctors. Lifespan considerations. Children with somatic symptoms are likely to have a dysfunctional educational experience, whether this is just from Munchausen syndrome in general, anxiety causing somatic symptoms, or Munchausen by proxy, which is when a parent does things to their child to get attention. But we're not focusing on that right now. But often it causes people or children to stay out of school or miss a lot of days in school, and they're not learning the material that they need to know. And it's just similar to them not even going to school. They're not getting their social skills in, they're not developing as well, and it causes a lot of issues in the future. For later life, there's a lot of comorbidities, including anxiety, depression, and other mental disorders. And that just makes treatment even more difficult than how it was originally. Related disorders, there's somatic symptom disorder, malingering, illness anxiety disorder, and conversion disorder. These are all somatic disorders. I also have this little chart here. I thought it was interesting between these 3 different kinds of somatic disorders. It explains whether or not there's actual gain or reason behind why people are doing this. If it's deliberate, if it's considered as a psychiatric disorder, and if the person will agree to have procedures done to them. As you can see, Munchausen or factitious disorder got an X in all 3 of those, and their gain is to have a sick role or to be the patient. Risk factors include chronic illnesses during childhood, chronic illness of a significant family member while the patient's at a young age, relationship problems, difficult distinguishing reality from fantasy, the ability to lie and manipulate, and a history of mental problems like depression, hallucinations, or PTSD. The medical management for Munchausen syndrome. Not a lot has been proven since people are so often to leave the hospital and deny actual treatment for Munchausen syndrome. But medications have been proven not to help alone, but they help with the comorbid disorders, so like anxiety and depression. If the individual actually meets the diagnostic criteria for anxiety or mood disorders to have depression, then they are more apt to have a prescription for these drugs. Psychotherapy has also proven helpful. That is, if the patient is willing to participate and go and actually remain in treatment. And patient education is the most helpful. It can be difficult to get to the patient to be able to talk about everything. But if the practitioner can fully explain the syndrome to them and the morbidities that can come with continued, behaviors of Munchausen and symptoms, it can get worse over time. Local community support was a little difficult to find since the disease is so rare. There wasn't really anything local around here. But any doctor that the person goes to or communicates with would be able to assist in finding a local therapist or psychologist so they could receive cognitive behavioral therapy or medications or treatments. But there are a few countrywide different organizations that are specific for Munchausen. The American Academy of Family Physicians, American Psychological Association, Mothers Against Munchausen by Proxy, which is a really cool organization. You should check that out, and National Mental Health Association. The evidence-based medical treatment for Munchausen syndrome is psychotherapy, anxiety or depression medication. As I touched on earlier, they have to have anxiety or a mood disorder diagnostic criteria met to be order to have the prescription for these meds. And the length of treatment was found to be very helpful with actually treating the patient. Since I mentioned they're very likely to leave the hospital, having just one session isn't going to be very helpful. So actually staying for different treatments and coming to therapy is going to be more helpful for these patients than anything at all. Occupational therapy services that can occur for people with Munchausen syndrome is cognitive and emotional regulation. This is really important to understand where the behaviors are coming from and to find different activities for the person to participate in instead of injuring themselves or inducing some sort of symptoms. Another thing that was found to be helpful through occupational therapy was emotional expression and positive activities to redirect attention, as I kind of touched on earlier. A lot of these people are doing this to satisfy an emotional need that they have, and a way to express that emotion in a different way than inducing some sort of symptom onto themselves is a lot better. It's also good to redirect their activities towards more positive things that they can spend their time on and put their attention towards. So occupational performance areas that are impacted include work, social, self-care, and leisure. All of these are often just taken up from time that is used for people inducing these symptoms on themselves and going through the time finding hospitals and doctors that they haven't been to before, researching different disorders and things that they can do to themselves. This also impacts cognitive skills, social skills, and motor skills in the long run. So